and I'm going to be chairing this session, and I'm also going to be doing a presentation. There is a little bit of housekeeping that I want to go through. Please will you ensure that your mobile phones are switched off or indeed on silent. Though I have to say sometimes even if they're on silent they interfere with the AV, so off is probably better. You can find feedback forms in your pack, and it would really help the organisers if you gave some very direct feedback, with the exception of my presentation, of course. And also that there is an opportunity for you to use these sessions for your CPD. So just to remind you that you can do that, and there is a form in your pack. Okay, I think that is about everything, and I look forward to hearing some really interesting presentations. I'm going to start today looking at the future for care in the 21st century. What I want to do is look at how the government wants to position the vision for social care, talk about some of the challenges that makes for the individual organisations who have to deliver, particularly when you have to deliver really significant amounts of improved quality, sometimes on significantly less resources. I am going to talk as well a little bit about my organisation, the English Community Care Association. And the reason I do that is because it will give you some idea of where the ideas and views that I have are coming from. We are the largest representative body in the care sector, and we have over 6,000 care services in membership. So this is a significant part of the sector. We are well known to be the representative body for large corporate providers, but what I also want to underline is that we work on behalf of both small and medium providers as well. And we cross the continuum between charities and private businesses. And why I think that's important is because the government has an agenda which pretends that any service that's outsourced is outsourced to a charity. In actual fact, about 70% of services that are outsourced are in the commercial sector. What we believe at ECCA is that we should not differentiate between charities and private providers. We're all providing services in a very tough environment, and so sector neutrality is where we're positioning ourselves in relation to this agenda. I want to look at why we need to change the current system. And I think when we're talking about the need for change, we need to examine not only the issues about finance, but we also need to be very clear that our current system is completely broken and not fit for purpose. It certainly does not meet the aspirations of the 21st century citizen. The first thing to say is that the government's new bill, which is going through, the social care bill, which is going through its passage in Parliament at the moment, and indeed the health and social care bill which preceded it, were a really clear attempt to tidy up this fragmented legal framework. And what we'd had in the past were lots and lots of bills overlaid across one another over a period of about 25 and 30 years. Some of them were not coordinated very well, and in fact some bits of the legislation contradicted others. So there was a desperate need to tidy up the legislative framework and to make things much more clear for everybody in social care. There was, of course, also the need to respond to cuts in the health and social care system. Though what I would say about that is the cuts have been in the social care bit, not in the health bit. And I think it's rather perverse that we have in this country 121 billion spent in health and only about 8 billion in social care, and yet it was the social care bit that is suffering the cuts. I think this stems from the fact that we have in effect a 1946 model of healthcare. In 1946, you diagnosed, you intervened, and you were able to cure people. Well, the reality of the 21st century is that people can be diagnosed, there can be medical interventions, but you cannot cure long-term conditions. Conditions like dementia, Parkinson's, and the myriad of things like diabetes are not able to be cured. And the challenge in the 21st century is to enable people to live well with those long-term conditions. So I think the fact that we've got a protected health budget and a social care budget that's under constant attack is a very, very bad way to run a 21st century health and social care system. I have to say as well, I think the fact that health is being protected is leading to a degree of sloppiness in the health side. And however much they whinge and squeal about the fact that they've got finance constraints, we should also remind ourselves that they're not nearly as bad as the ones that we suffer in social care. And the fact that they're not having to be really focused on the efficiencies agenda is leading to some quite ridiculous inconsistencies in the system. I wish governments would stop thinking that you have to do structural change in order to get change. I wish they would spend a quarter of what they've spent in structural change over the years on attitudinal and cultural change in the system. The reason I think that's important is because we currently see a health service that does not commission outcomes, it commissions health services. Now, if we look across social care, we in social care are ready and able to deliver a range of outcomes for people with long-term conditions. Arguably, it is social care where the expertise lies in the management and support of long-term conditions. And yet that 121 billion in health is nearly impossible for us to get our hands on, even though we can show clear outcomes and better use of resources. But because of the way in which the system is configured, nobody in health seems to be looking to the social care sector as the place where they can commission their outcomes. I have to say, in all the configuration, in all the change there's been recently on the health side, I have no confidence that will change. A little anecdote to illustrate that. I went to a meeting before Christmas about the reconfiguration of the Dulwich Hospital site. I'm a Lambeth Transformation Commissioner, and I went in my role at Lambeth. And I was confronted with a room, and can you believe this? I'm there, one person, asking for a bit of information. I was confronted with a room of 21 people. And when they asked the introduction process, they all said, I'm director of this today, and after the reconfiguration, I'll be director of that. And I was minded to think, if you rearrange the deck chairs on the Titanic, the ship still sinks. If these people had got creativity riven through them, the old system would have worked better. So I think there's a real challenge around how social care gets itself to the table around the development of these new approaches to outcomes. We've also got a very dependency-based system. So it's about trying to give people services when they are at the absolute point of crisis. And the current situation means that in order to get a publicly funded social care service, you have got to be in absolute crisis. I think in terms of residential care, we have a real challenge in that people in government particularly talk about silly nonsense like everybody wants to stay in their own home, everybody in their own home is living independently. Well, why people are advocating that is nothing to do with what people want or indeed need. It's because they take people with very high-level needs and they give them very low-level services. And that means that people are just kept on the cusp of being in crisis. And then finally they fall into crisis. And that's when residential care has to come up and pick up the fact that some of the community services are failing. And I don't blame the providers of community services. I blame a system that doesn't do proper interventions at the right time. There's also variable quality within the system. And I have to say that goes for both providers and commissioners. And we've got to get quality as the bedrock of how we deliver care services. And we've also got to get away from commissioning for budgets, and we've got to get into a space where we commission for outcomes. The way in which that will be achieved, though, is by much more flow of resources across the system. rather than them being in their silos, which say either health or social care. I have to say, when I look at the new vision for social care services that the government has articulated in the care bill and indeed in the health bills, I think none of us would disagree with this vision. I think this vision is absolutely where we need to be. It's about moving us from a crisis service to a well-being service, looking at not the needs of the state, but the needs of the individual. I remember having a conversation with a chief executive of a very large corporate, and I'd been to one of her services, and I'd spoken to one of her service users. And I said to her, well, that person wasn't happy, and you need to know if you lose touch with your customer, you have a business that will potentially fail. And her response to me was, sadly, my resident is not my customer. My customer is the person who sits 4 miles down the road in a local authority commissioning department and who tells me that despite the fact that my service user wants it, as the commissioner, she's not going to allow it. So I think we need to remind ourselves that if we're going to make this quantum leap from individual needs towards individual needs, we've got to get the system understanding that it's about how you empower and enable residents and families and don't impose things which are about the needs of a whole raft of things like a local authority budget. Also, one of the other things that I think is really good in this new vision is this notion of the individual who's receiving services also being a contributor. Too often in the old system, what happened was people were placed in a category which says, oh God, you need services, this is about you being the recipient of everything. And actually, every person, every human being has something that they contribute, and we need to remind ourselves of that. The issue about disability, which is in the current system, turned on its head to be about not what people can't do, but about what they can do. And I have to say, I've seen some really good examples in residential care where people have been supported and enabled and have really started to live a life and have well-being, which they didn't have before because the support they got was so sporadic and so small scale. So I think this is a song that we in the residential care sector need to sing more, which is about how we enable people to live a life rather than get a service. There's a lot of talk in the new vision about this integrated approach, moving away from these silos. I have to say, I've yet to see very clear evidence of it. So I think this is an aspiration that's not being delivered. And of course, nobody in the system now is monitoring whether or not there is that integration. Theoretically, we have an integrated regulator, and I'm well known for having very clear views about the appalling state of the regulator. But I have to say, I am very much heartened by the arrival of David Pryor as the new chair, some of his new commissioners who I've spoken to, who I'm very impressed with, and certainly I'm impressed with David Bean as the chief executive, who has really given some clarity about the role of the inspector. So my view is that we're moving in the right direction, but I also said, I was asked to speak at their launch, and I said at the end that I'm going to be holding their feet to the fire because they need to be making progress, and that progress needs to be visible and it needs to be quick, because if you're a care provider, they don't give you forever to get your act together. So I don't expect large quangos that are funded by the taxpayer to have inordinate amounts of time to deliver acceptable services. And I think David Pryor particularly and David Bean understand that. But we are in a transition period as far as the regulator is concerned. And I hope the regulator will start to push the agenda on integration. The regulator has lost their power to comment on commissioning in a formal and structural way. But I have been very clear with commissioners at CQC that they might not have structural power, but they have great influence. And I was delighted to see that David Bean had put as one of the primary influences on quality the role of commissioning. So I think there is a big opportunity for us to work with an integrated regulator to see more integration. And the other issue is about trying to reposition individuals who receive care services at the very heart of their communities. We have started that process with the development of the Care Homes Open Day, which is taking place this year on the 21st of June. And what I hope will happen is that lots of care homes will use this as an opportunity to engage their local areas and to get people into their services so that they understand better how they're working. There are some big challenges in this system, and particularly in a system in transition with a reduction in resources. But I also think there are some big opportunities. And I would say to care providers, if you look at the history of innovation and creativity, it has never come from the commissioner side. It has always been about the provider side, innovating, creating, engaging with their service users and responding to need. And I think we shouldn't wait for the system to deliver us a solution. I think we have to think strategically about how we develop our services. I think that's also very important because if you look at the public purse, the notion of traditional residential care as it is currently configured with services, particularly services that only take people who are publicly funded, the bottom line is that is not sustainable in the long term because there are not enough resources in that bit of the system. So I think we need to think about how we develop our services and integrate. A very interesting example of that was a member of mine who had a 40-bed care service which was failing because of the local authority funding and also because of the local authority reluctance to make placements. So the bit about funding is one element in this equation, but the occupancy levels are another. When she was faced with this, she didn't hunker down, she started thinking creatively. So she started and thought about changing her service into an 80-session dementia service. She developed things like night sitting services for people with dementia who had challenging behaviour and were living in the community. She formed a strategic partnership with the Age UK in her area to get as many people as possible onto both direct payments and attendance allowance, so they had the money